Hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison, but actually from our living rooms. I'm Jenny Romich. I'm the director of the West Coast Poverty Center at the University of Washington in Seattle, and I'll be your host today. The West Coast Poverty Center is part of the collaborative of U.S. Poverty Centers, which IRP leads. Before we get going, I wanted to give a few technical notes. We have a big audience today. Thank you all. And sometimes that can lead to bandwidth or connectivity issues for some of our audience. So to help with that, we're mirroring this call on Zoom. The information for that is on the left-hand side of your screen. We'll also have a recording of the webinar available later this week that you can check out, and we'll send out copies of the slides when we stop the recording. So thank you to Dave Chancellor from IRP, IRP Director Catherine Magnuson, and the rest of their Crackerjack staff for all the support they offer to this webinar and to the Poverty Research Center or community in general. So for today's webinar, we're talking about estimating poverty in the COVID-19 era, and we have a great panel to discuss that. But before I introduce them, I wanted to talk about why I organized this webinar. Back in March, as the possible extent of the pandemic-related unemployment and economic effects were becoming clear, I was in touch with some leaders in Washington State at our Economic Security Department within our State Department of Social and Health Services. And they had ongoing concerns about the well-being of Washingtonians, wondered about the economic well-being, particularly of the lower-income families they serve, and were also looking for evidence on which they could base their caseload projections. Typically, poverty measurement numbers come out in the fall for the previous year, but there were some policymakers' questions that couldn't wait until the 2020 poverty numbers come out in fall 2021. So we needed some projections. Some way to combine what we know about the demographics of poverty with what we were figuring out about the changes in the economy. But luckily there are people doing that work out there, and so we're going to be hearing today from representatives from two different groups doing poverty forecasting. Our first presentation will be from Zachary Parolin of the Columbia University Center on Poverty and Social Policy, another member center of the Collaborative of Poverty Centers. And our second will be Linda Giannarelli from the Urban Institute. Then to put their forecasts into context, we have two more experts who will serve as discussants today. Pamela McCauley from the Minnesota Department of Health Services will give some perspective from state government, and I really appreciate her taking the time out of her schedule to be with us today. And Bradley Hardy of American University will give a scholarly perspective as well. And thank you to Bradley for taking his time. He's also the newly appointed chair of his program, so we're grateful he's here. And we'll save the last few minutes to take questions that you have for everyone on the panel. So thank you to Zach, to Linda, to Pamela and Hardy, and Bradley. And let's get started with Zach. Thank you.
Great. Thank you, Jenny, for the introduction, and also thanks to the IRP team for organizing this event today. My name is Zach Parolin. I'm a postdoctoral researcher at the Center on Poverty and Social Policy at Columbia University. And a couple weeks ago, with my colleagues Megan Curran and Christopher Weimer, we released a report focusing on the effect of the CARES Act, the projected effect of the CARES Act on poverty rates amidst the current crisis. And as you can see on the PowerPoint here, we labeled this report the promises and pitfalls of the CARES Act, and that's exactly what I'm going to talk about today. Some of the upsides of the CARES Act and its potential effects on poverty rates, but also some of its limitations and some areas that need to be addressed. So I'll start with a little bit of background on why this research is necessary. The Census Bureau releases official estimates of poverty every year, but those come with a considerable lag. As of today, for example, the latest estimates of poverty we have from the Census Bureau are from the year 2018, and official estimates of 2020 poverty will not be available for some time. So there's no replacement for the thoroughness of the Census Bureau's estimates, for the quality of estimates, but there are times when we need to try to be able to make more current projections based on the terrific work that they've done for us in the past. And this clearly is one of those times. So our objectives with the team at the Center on Poverty and Social Policy are as follows. First, we have been working to provide a framework for providing monthly updates of poverty. And second, we want to understand how policy changes, such as those in the CARES Act, affect our projections of current poverty. To narrow in on those a little bit more, when we project monthly updates of poverty, we're primarily using the Supplemental Poverty Measure Framework, or the SPM. And as many of you on the call know, the SPM is generally understood to be a more scientifically advanced measure of poverty. It takes into account, compared to the OPM, the official poverty measure, that is, it takes into account all taxes and transfers, it adjusts for geographic differences in living costs, and so forth. So we're going to be looking at the SPM in this study. And that second objective I mentioned, looking at how policy changes affect current rates of poverty, well, some of the most important policy changes of late are those in the CARES Act. And in particular, we'll be looking at the expanded unemployment benefits, including that $600 a week bonus that is set to expire at the end of this month, and the recovery rebates, or the stimulus checks, or the EIC payments, as they're also known. I'm only going to spend a minute or so on data and methods to try to get some idea of how we're making our projections, and then I'm happy to come back to any questions related to these projections or these methods later on. But in short, this is what we're working with, as you can see on the screen. We have what's called the CPS-ASEC. That's our large file that the census releases each year with comprehensive information on family income and supplemental poverty measure poverty status. That's released annually. The latest version we have is from 2019, which covers reference year 2018. But there's also a monthly file that the CPS releases each month. That's current. We have that as of June 2020 right now. And that has updated information on employment, on demographic characteristics, and so forth. But it doesn't have that information on poverty status that we would like. So what we're going to try to do is take everything in this green box here that's common across both of these samples. So that's your demographics, your employment characteristics, and so forth, household composition, etc. And we're going to use the information in that green box to try to do this, to try to get that poverty status, to project it from the CPS-ASEC to the monthly files using some tools referred to as combined sample multiple imputation. So I want to be very clear what we do project and what we do not project. We are projecting annual poverty rates updated on a monthly basis to take into account that updated labor market and demographic information that we see in the monthly files. So in other words, this is based on a family unit's annual resources, or projected annual resources, despite the fact that we're updating it monthly. And we realize that conceptually that's a bit tricky and confusing, and that's something we're working on, but I just want to state that to be very clear about what we are projecting. We are looking at annual income. We do not yet project poverty rates based on a family unit's monthly resources, but that's something that we're working on now and hope to move to in the future. So this slide here provides a little bit of a glimpse on how poverty rates have evolved over the last 12 months or so. This is before taking the CARES Act into account. And you can see on the x-axis here at the bottom, you have the months in 2019 leading up to April 2020. And you have two lines on the screen. The top one is the SPM before taking taxes and transfers into account. That's up here. And the bottom line here is after taking taxes and transfers into account. So if you look up here first, you see in April 2020, we see this big spike in pre-tax, pre-transfer poverty. That's not surprising. We saw unemployment rates that spiked to nearly 20% after adjusting for misclassification this month. We can see in all months, the welfare state does quite a bit in reducing poverty rates. And that's true even in April of 2020. But even after taking into account SNAP and the EITC, et cetera, we still see a poverty rate around 16.3% we project as of April 2020 before taking the CARES Act into account. And to put this number into perspective, 16.3% is higher than the rates of poverty we saw during the Great Recession and some of the highest poverty rates we've seen since official statistics on poverty began about 50 years ago. So what happens when we take the CARES Act into account? That's what we're going to try to figure out. But first, a couple notes on what precisely we're looking at. The CARES Act, the two components we're most concerned about are these expanded unemployment benefits. That includes the PUC, or the $600 a week bonus that's set to expire. That includes the PUA, or that expansion of access to unemployment benefits, so that part-time workers or gig workers or freelancers could have access to unemployment benefits as well, which is not the case in normal times. And the PEUC, or that extension of the duration beyond 26 weeks in most states. We're going to be looking at that, but also the stimulus checks, of course, which some people refer to as EIT payments or recovery rebates. So say a word on our assumptions as well. As many of you know, a lot of families out there have had trouble accessing the CARES Act financing. And we, of course, want to take that into account in our projections. So we prioritize what we call a medium access scenario, where we give the expanded unemployment benefits to 60% of the recent jobless, rather than all of them, and the stimulus checks to about 70% of eligible families. This first one, the 60% number, roughly lines up with what we're seeing from federal UI records right now. So the promises, what are the positives of the CARES Act? That's what we're going to look at first. The most important thing to know to start is that the CARES Act is just absolutely massive. What I've done here is just plotted the projected spending in billions of dollars for the CARES Act transfers. That's the two black bars here, compared to spending on all non-CARES Act transfers toward the working age population and children in 2019. And you can see that both the unemployment benefits and the recovery rebates are just much larger than EITC or SNAP or anything that we've done in the past. If you add those benefits together, that's about $500 billion worth of transfers from the CARES Act, which is more, again, than all of these gray bars down here combined. Put differently, the CARES Act is bringing in more income transfers to the non-retirement population than we did in all of 2019 through all transfers combined. And a lot of money, and of course it should be, considering the magnitude of the current crisis that we're in. So what effect does this have on poverty rates? That's the big question. So we're going to show that here. First, this is projections of SPM poverty rates before and after the CARES Act. And the first number to focus on is the one on the far left of your screen that says pre-crisis. We estimate that as of around February 2020, the SPM poverty rate was about 12.5%. In April, when unemployment spiked, we estimate that that climbed to about 16.3%. Again, after taking into account SNAP, the EITC, and so forth, but before taking into account the CARES Act. When we bring the CARES Act into play, if we look at this medium access scenario, we see that we project poverty rates to fall to about 12.7%, which is pretty close to our baseline number, our pre-crisis number that we saw over here. Could be lower or higher, depending on whether we have that low access or high access scenario, but for a medium access scenario, it basically gets us back to baseline. We can also look at this by demographic group. The story is roughly similar for most demographic groups, but what I want to emphasize is even with the CARES Act, we see massive racial and ethnic disparities in poverty. Of course, that's true at baseline as well, but I just want to emphasize that the CARES Act getting us back to baseline does not mean that everything is okay. It's still the case that the average black individual has twice the likelihood of poverty compared to the average white individual. Child poverty still hovering around 14%, And of course, working or retirement age adults are a little bit less affected, primarily due to the fact that most of them are not currently working. One more point on the pros of the CARES Act before I spend 2 minutes on the cons. This is projections of estimated poverty rate by employment status. You can see on the far left here, this is the poverty rate for individuals who are employed. The black bar is before taking the CARES Act into account, and the gray bar after. These employed individuals often receive the recovery rebates, so that's why you see a slight decline in their poverty rate, down to about 6.7% after the CARES Act. This middle group is the recent jobless, but who are receiving those unemployment benefits. And the number I want you to focus on is the 6.4. That's suggesting that for the individuals who receive those unemployment benefits, who recently lost their job, only about 6.4% of them are in poverty based on projection of annual income, which is pretty close to this employed group over here. Put simply, for the families receiving those expanded unemployment benefits, it's often doing its job to prevent them from falling into poverty. And this group over here does not receive the unemployment benefits, and you can see poverty rates upwards of 30%. So those are the positives of the CARES Act, but of course there are some pitfalls or some limitations that need to be mentioned. First, this is a figure we include in our report, and I'm not going to spend too much time on it, but it illustrates the income volatility that the CARES Act imposes on a family. This is each month at the bottom, and a family's income situation by month throughout this year. And you can see, especially after the CARES Act and the PUC benefits expire in July, that could go right back down to very little income support, despite the fact that this family, based on its annual income, is above the poverty line. Again, this scenario in May, where there's no income support, perhaps due to delays in state unemployment benefits, this family could go a month without receiving any type of income support, despite the fact that it is above the poverty line. So I just want to emphasize again that annual income might not be the best indicator of the family's well-being right now for the reasons you see here on the screen. It's important to note that many families are explicitly left out of the CARES Act. Families with undocumented immigrants, adults claimed by families and dependents, altogether about 30 million income eligible individuals. And my colleagues Megan Curran and Sophie Collier have done more on this. If you're interested in their work, please do check out the center's website. They've done more on who is left out of the CARES Act benefits. And finally, despite the fact that we see some progress, or at least some useful effects of the CARES Act on poverty rates, it's still the case that we see high levels of food insecurity, high levels of stress and anxiety, and large concerns about the ability to pay rent, mortgage, and so forth. So there's a lot more work to do, and I know we'll talk more later on about what should be done going ahead. So let me conclude. In the absence of the CARES Act, we see that poverty rates have spiked to levels higher than those observed during the Great Recession. With the CARES Act, poverty rates have perhaps returned to pre-crisis levels, but the benefits, the PUC benefits, are set to expire. Too many families are left out. There's large access challenges, and we see high levels of food insecurity right now. What's next? We're working on what I mentioned to get to a monthly estimate of poverty based on monthly resources, and we're also looking more into that mismatch between food insecurity and poverty. So I'll stop there. Thanks again to Jenny and IRP team for organizing this.
Great. Thank you, Zachary. Our next speaker will be Linda Giannarelli, but I also wanted to remind people, I see a few questions coming in. You can submit questions at any point using the Q&A feature on the left-hand side of your screen, and we'll hope to get to many of them in the discussion. All right. Thank you, Linda.
Here we go. Hi, can everybody hear me okay?
Yes.
Yes, okay. Just didn't want to be sitting here talking and having no voice coming out. So thank you again for organizing this webinar and in inviting me to participate. Really appreciate that. So there's a lot of similarities between the work that we've been doing at the Urban Institute and the work that Zach and his colleagues have been doing. So it was really interesting for me as well to hear Zach's presentation. There are a lot of similar findings in the work that we've done, despite the fact that we've used a quite different approach to get to those findings. So I think that gives some confidence in the bottom line results that we're both getting. So our work at the Urban Institute, what we focused on was the 2020 poverty. Again, this paper is looking at annual, just like the work of Zach and his colleagues. Poverty in 2020 with and without key COVID response policies. This is joint work. I'm sitting here talking, but this work involved a large group of people. Our first paper involved Laura Wheaton and Greg Och as co-authors, and we have a large modeling team backing us up. The approach that we used to addressing these issues was to use the ADIS microsimulation model. I will not bore you all with a long explanation of what microsimulation is, although there's a little bit of information in our paper and happy to talk more about that. A key point is that ADIS relies on the American Community Survey, the ACS, which enabled us to do state-level modeling. Like Zach's team, the work is ongoing. Our funding was from Robert Wood Johnson Foundation. So I'll start with an overall highlight. The number of people in poverty on an annual basis in 2020, we think will be 10.3 million due to the key COVID response policies, and I'll tell you in a minute what I mean by those. So that represents about 3.2% of the population. In other words, we think there's about 3% of the population that won't be poor on an annual basis this year because of the policies that were enacted that would have been poor if those extra policies had not been enacted. So I'll just talk real briefly about our methods, some of our key assumptions, then show you some more results, show you a little bit about the impacts for people in households with and without job loss, and then talk about our next steps. Some highlights of our methods. We started from the 2018 ACS data. Then what we did in those data with the microsimulation model was we took away jobs from enough people to mimic the job loss in the COVID recession, using data from the BLS, from the establishment survey, from the monthly CPS files to figure out what that should look like. Then we again used the ADIS microsimulation model to model changes in key programs. First, we modeled the changes that would have happened anyway, even if no new legislation had been passed. Then we modeled what would happen to people and families with those COVID response policies in place, and then we calculated poverty both ways. Just a few points on job loss in our version of 2020. 24 million people are modeled to lose their jobs starting in April. The probability varies by state, industry, and demographics. We simulate that a portion come back to work every month, and we base that on BLS data for May, actual, and also the CBO estimate for the fourth quarter. So what are the changes that would have happened in families' incomes without the COVID response policies? First, the big one is what I already mentioned. Some people would lose their jobs and therefore their earnings for anywhere between 1 and 9 months. There would have been unemployment benefits even without any new legislation. As Zach already mentioned, not everybody's eligible. And even if you are eligible, unemployment benefits don't replace all of your earnings. One other thing that would have happened even without legislation is that the extended benefit week, EB weeks, would have triggered on, to use the BLS terminology, those weeks would have triggered on in most states due to high unemployment even without any new legislation, meaning that people in most cases would have been eligible for more than 26 weeks of benefits even if they fell in a category that was eligible in the first place. Another thing that would have happened is that people might have become eligible for TANF or SNAP, even if they weren't before, or eligible for higher benefits due to lost earnings. And all of that's getting picked up in the microsimulation modeling. But additional things happen with the COVID response policies. Zach already talked about the unemployment benefit changes, expanded eligibility, particularly helping self-employed people, more weeks of benefits on top of the EB weeks, meaning that nobody will run out of weeks in 2020, and on top of everything else, the extra $600 a week for April through July. Second, something that this was in the Families First Act, changes in SNAP benefits. For anywhere between 3 and 5 months, depending on choices made by states, what waiver and how long they asked for this waiver to be in effect, everyone receiving SNAP can receive the maximum allotment of the SNAP benefit, which if a family was not already receiving that maximum allotment, this means they're getting more SNAP per every month. Also, the rules that restrict adults without dependents in terms of the length of time they can receive SNAP, those rules were temporarily not applied. And last but not least, the stimulus check that Zach has already talked about. For this analysis, we used a modified definition of poverty. We are using the official measure plus. So we're using the official poverty thresholds, but for resources, instead of using just cash income, which is the official measure, which would not have picked up the benefits of either SNAP or the stimulus checks, we're adding the value of your annual SNAP benefits and the value of the stimulus checks to your annual cash income. A key thing on this is we want, we're looking at the change in that poverty measure, not focusing on the levels because it's not really comparable to the official poverty measure because of what we added in. So how much difference did the response policies make? I already gave you the overall bottom line, 10.3 million. We can look at that a little bit more. With our modified definition of poverty, we get a poverty rate of 12.4% annual, which has all the limitations of the annual measure that Zach already mentioned. So 12.4% annual poverty rate with our modified measure without response policies, and 9.2% with those response policies. And that gives us our 10.3 million fewer people in poverty due to the response policies. We also looked at that by race and ethnicity. Very similar story here to what we saw in the other analysis, is that the response policies are effective for all racial and ethnic groups, but that the differences in the disparities in poverty across racial and ethnic groups persist with and without the policies. We can look at the changes, at the reduction in the number of poor people in percentage terms as well, and that percentage reduction is about the same across racial and ethnic groups. It's a little bit less for Hispanic families, but not too much less. We can also look at the percentage reduction in the number of poor people due to the policies by state, and there's a lot more detail on this in our full paper. For most states, in most states, the reduction in poverty due to the response policies falls between about 22 and 26.5%, with some on the low end and some on the higher end. The differences are due in part to variations in job loss across states, as well as characteristics of the state's population and the depth of poverty before the recession. We also want to look a little bit at people in households with and without job loss. First of all, our 24 million people with job loss translates into 67.7 million people in a household where someone lost a job in our simulated data. So this slide is breaking down that 10.3 million people kept out of poverty by the policies into those in households with and without job loss. Of the 10.3 million people kept out of poverty by the policies, 4.3 million are in a household with job loss. However, 6 million are in households without job loss. And that's the stimulus aspect of the changes. There are a lot of people who are very close to the poverty threshold, and when they get the stimulus check and or higher SNAP benefits, they move above that very low line. So a lot of the reduction in poverty in our modeling is coming from the people in households without job loss. This breaks down the people in households with job loss. At the top, that 4.3 million who would have been in poverty without the policies, but now they're not. 6.3 million are below poverty with or without the policies, and 57.1 million above poverty with or without the policies. That 6.3 million below poverty with or without the policies is a concerning group for more policy changes. Some reasons that people in households with job loss do not have their resources raised above the poverty line. As Zach mentioned already, unauthorized immigrants are not eligible for benefits. There are also people eligible for unemployment benefits but who don't receive them. And non-tax filers who don't automatically receive the stimulus check even if they're eligible for it. So highlights of our conclusions. The policies have kept annual income above the poverty level by our definition for many but not all of the families with job loss. And I also want to stress that fact that annual income is not picking up the hardships that many families faced, for instance, in delays of a month or 2 months in receiving unemployment compensation, even if they did ultimately receive it. Families still unemployed later in the year may experience hardship because not everyone is able to save or put aside their $600 a week to use later. Also, stimulus checks and higher SNAP benefits raise resources above poverty for many families with no job loss, which is intentional from the fact that there was an attempt to stimulate the economy, give people more money to spend. Next steps, things that we're working on, we'll be updating our simulation of the recession to incorporate new information. We also want to update it so that we're not only modeling job losses, but also modeling earnings reductions. We're doing some calculations now, focusing on poverty just during August to December. And we're also doing some modeling to look at what-ifs of what would August to December look like if a couple of different policy changes were enacted on top of what's already been enacted. Where we'd also like to move to modeling poverty with the SPM and explore changes for subgroups of families. Our full paper is available if you'd like to read more, particularly state-by-state results are in the full paper. And either me, Laura, or Greg would love to hear from you with any additional questions or comments. And I couldn't resist throwing in, I think when the slides get posted, there's some additional details at the end that I didn't have time to talk about. So thank you very much and look forward to hearing more.
Okay, thank you, Linda. I will mention that we will be posting the full sets of slides, and there will be links to the original reports going up as well. So next, to help us put these two sets of projections into context, we have Pamela McCauley from the Minnesota Department of Health Services, All right, Pamela, thank you.
Good afternoon, everyone. I'm going to warn you in advance. I suspect my dog will start barking at any moment now, so I apologize in advance. I can see she's prepping, but I'll do my best to keep her quiet. So again, thank you for having me as part of this session. I want to just start by saying that the efforts that Minnesota is taking has definitely been a coordinated effort with many of our state agencies, such as the Department of Employment Economic Development. Again, the Department of Human Services, Housing, and many other agencies are developing a plan on how the state can help those who are most in need with including assistance with food, housing, mental health, and more Minnesotans that are in need at this time. So we are currently working on a communication plan and an outreach strategy that will share out with our external partners on how we can amplify our outreach as well as the resources over the next few weeks. We are working with community services agencies, financial assistance agencies, helping with the food need, healthcare, housing, transportation, vet services, job data and retraining opportunities through our career force centers where our folks go to seek out employment, assuming that they're open. Many of our career force centers are still currently closed due to the pandemic. And also working with our dislocated worker services. So specific to the TANF program, which in Minnesota is called Minnesota Family Investment Program, I'm quite sure I'll slip into acronyms, and so when I say MFIP, I am referring to our TANF program, the Minnesota Family Investment Program. So along with our policy team members as well as our research and evaluation team, we've been planning for an increase in the need for assistance due to the additional unemployment that will be ending soon. We were granted an additional 30 days of waivers from our governor and our legislature during a special session, so many of the waivers have been extended in our state for another 30 days. Those waivers, of course, came about due to the public health emergency. But we do know when this ends that reporting requirements that were not required during the pandemic will resume, and we expect many of our families will lose eligibility for our program. So we are planning for an increase in need and eligibility for our programs that focus on families living with low income. We know that resources that are now available may end once the public health emergency is deemed to be over. And for example, we have a mandate on evictions right now, and once that mandate ends, we expect that there'll be an increase in need for emergency housing assistance. We know that many of our counties have received additional funding via the CARES Act to assist with housing, and we're also, which is great, we're working with those counties on how they can disperse those additional funds. And we're also working with our counties and tribes on how they can be more flexible with their annual allocation to help meet the needs of families. So these are all things that we expect to be happening and trying to be proactive around planning. Again, with our DEED agency, we're monitoring the job market and what the labor force is going to look like, because we know that that will matter once this pandemic or the public health emergency ends. Our focus for our program being on families living with low income, typically in hospitality, retail, and entry-level healthcare positions. We know that there's a lack of a safety net that genuinely meets the needs of this particular population, specifically our African American and American Indian populations. Unfortunately, Minnesota is not ranked. We're ranked number 2 behind Wisconsin around our disparities in areas with our African American and American Indian population. So we know that working proactively to forecast where the need will be is really important right now. We understand that there will be families losing the pandemic unemployment eligibility. We expect that they'll be applying for public assistance. But for those families that are losing that pandemic unemployment and may be eligible for cash assistance or SNAP, food support, if they are, they still may be eligible for regular unemployment. I apologize. They may still be regular for regular unemployment, but we know that it won't be a majority of our families. But if they are, those benefits will reduce their cash and SNAP benefits dollar for dollar for any unemployment benefits that they continue to receive. So even if we do have some low-income families that may be eligible for regular unemployment, that unemployment will count against any public assistance dollars that they receive. So again, we know that the end of the pandemic unemployment will likely exacerbate income disparities for people of color, American Indians, and also women in Minnesota, who are overly concentrated in the occupations and industries whose low income wages set them up for that minimal unemployment benefit. In addition, our research team is doing an analysis of wage detail industry data showing what sector families turning to our programs are or were working in prior to the public health emergency. We're reviewing trends in searches for food support in Minnesota over the past year. We've also been tracking the number of applications for our TANF programs, the SNAP program, our diversionary work program, which is a 4-month program that anyone who has not received our TANF program in the past 12 months would have to go through that program first. It's a work first program where they're also eligible for food and cash, but again, prior to being eligible for TANF. And we're also tracking the numbers of applications for our refugee cash assistance programs. So we have seen a rise in applications for our Minnesota Family Investment Program and our SNAP program beginning in March. But I will say that the rate has stayed pretty constant. The rate of applications that we've received has stayed pretty constant since March of this year. The caseload for MFIP has stayed high since April, and SNAP is higher than the pre-COVID trends, but lower than the peak that we saw in April. So again, that's just one of the steps we're taking as far as tracking, forecasting, and planning. We're tracking the unemployment data as part of our planning to estimate the need for assistance post-COVID. Our MFIP cases have, due to the extended unemployment, our MFIP or TANF program cases and participants have seen an increase in their eligibility of 39% for the unemployment eligibility in the first quarter of 2020. But again, we expect that unemployment eligibility to decrease. So as far as our response to our response to COVID and then planning post-COVID, we have seen in our data that the additional assistance received via the CARES Act has been helpful, but again still does not meet the basic needs of our families that are living with low income. Part of the reason for that is the cost of goods and services has also increased during the pandemic. So although the additional income is appreciated, it still does not cover the increase in costs. Many of the additional food support services were mentioned by the previous presenters, and we have received some anecdotal information back from our community members that the extra food is great and they appreciate it, but right now what they really need is that cash portion. So just we have been trying since the beginning of the year to get an additional $500 in cash to our MFIP families. It's been to our legislatures twice, has not moved forward, but again, they're in special session and hopefully we're going to be able to move that initiative forward. That's unknown at this point, but we definitely have received the feedback the additional cash amount would be helpful to our low-income families. So I welcome any questions that may come from the data, the brief data that I gave you, and just our general overview of the planning and forecasting that we're doing in Minnesota. And again, thank you for this opportunity and look forward to hearing more.
Thank you, Pamela. Next, we'll hear from Bradley Hardy.
Great. So, I certainly enjoy hearing from both research studies as well as the comments from Pamela, given the Minnesota context. And so, I just want to kind of start off by saying that, on some level, I think that this crisis has revealed kind of broader cracks in the metaphorical foundation in terms of how, different types of families are doing pre-COVID by demographic group. Folks on the call know this already, but, many social scientists have been tracking that, we've seen households, especially those where the adults have fewer formal educational credentials, where they have limited savings cushion, lower earnings profiles, and, in many respects, we've seen folks in job categories and job classes where they've not seen meaningful raises for 30 plus years, especially when you layer onto that housing prices and things like this. And this generally more unstable earnings profiles as well. And this kind of alludes to the income volatility that Zach mentioned earlier. And so I think that, you know, the disparities we see showing up in the data are consistent with some of those cracks in the foundation that we observed pre-COVID. You know, I have a few responses and sort of thoughts moving forward. Again, many of which are informed by people on the call. You know, so one example here is just to say that the studies are really useful in reminding us about how supplemental poverty or even official poverty type measures are shaped by the CARES Act. And the big takeaway is that the CARES Act helped, that, you know, this economic relief mattered. But it's also worthwhile noting that, you know, these programs can also shape what we like to think of as the depth of poverty or near poverty status. And then you can just imagine that we have households and families where they weren't necessarily moved above a particular line, say 100% of poverty or even 200% of poverty, but their position was improved. And so that's just the kind of thing where we know these programs matter. The so-called head count matters quite a bit. And so this is exactly the right way you want to do it. But it's also worthwhile thinking about the idea that, you know, this liquidity, these resources mattered quite a bit for families, even if they weren't strictly lifted over a particular threshold. And again, I think that for the folks on the call, I know a lot of my work has focused on thinking about income volatility. And, you know, I think that people who are working in human services realize that, you know, even in the models that I'll work on and others on the call will work on, you know, the timing of the benefits is just really important to consider, that, you know, there's daily shocks and shortfalls. You know, if I'm in a state where the unemployment system has been strained, where there's all sorts of logistical issues in receipt of benefits, then you really worry about the idea that you might have some days where you really are coming up short. And so there's been some interesting work coming out, for example, from the JP Morgan Chase Institute, showing that there, you know, there are these really important consumption response differences, for example, by demographic groups. And this really kind of speaks to the notion that even as we think about our income definitions, you can have two households with very similar income levels where one household has more of a savings or wealth cushion, and they're in a position to withstand these shocks. And I think for that reason, you know, in my view, this is such just a unique crisis, because the crisis is hitting further up the income distribution in many ways. And I think there's just a lot that we don't know. So, you know, next I just kind of want to talk about some of the things that I'm looking forward towards. And frankly, the hard part about going last after three great presenters is that they've really made a lot of the great points. So I'll probably echo a little bit here. You know, there's a question about who's missed, right? We know there's some folks who aren't going to have active addresses. There's some housing instability there, you know, and so with that, you know, we know we're going to miss some people with these relief payments, maybe people who didn't even file taxes last year. And again, just thinking about unemployment systems at the state level that might vary in terms of whether and how they've been upgraded. So that's one thing I'm looking at. I guess another piece is just to think hard about housing stability issues and food sufficiency issues. So, you know, I think this was just alluded to by Pamela, as these bans on evictions are starting to be rescinded across states and across cities. I'm asking myself, what does that look like? In much of the social sciences literature, you know, the homelessness data collection process is difficult. Sometimes you have these kind of annual point-in-time surveys, and it strikes me that in my conversations with folks at the human service agency level, you know, this housing insecurity might not look like classic homelessness immediately, but there could be sort of shared housing situations that are maybe masked for a period of time. And so I know that's something I'm going to be watching out for. I guess another piece, and I want to allow for Q&A, so I'll try to kind of round this out quickly. Another piece that I just want to call attention to is that we've got some interesting questions about the nature of food hardships And they're subtle, and they're actually different across some of the data sets we're going to be seeing over the next couple of months and years. And so you have questions about families where they find their food to be insufficient. You have some questions that get at whether families are worried about consumption. And I think this is actually an interesting piece because what's harder to measure at the family level is the stress related to the uncertainty about labor market conditions that are then going to interact with the public health situation, which in and of itself is varying by city and state. And so that has all sorts of potential child developmental consequences that are going to be hard to measure but still very real. You have some survey data instruments that are going to ask questions about whether households can purchase the types of food they want or whether they have enough food. And so I think what I'm trying to get at here is that what I appreciate from both Zach and Linda, as well as the data collection efforts that are occurring at the state level via Pamela and others, is that we're really leaning on multiple data sets. And I think the idea is to try to triangulate around a correct set of answers. So whether it's state-level administrative data from Pamela, whether it's thinking about Urban Institute or Columbia University data forecasting exercises. You also have the Census Bureau's work from the current population survey that'll be with a lag. You have the Census Pulse data. You have the COVID impact study, among others. I think part of the idea is to try to put this all together. They're asking similar questions, but in some subtle ways that differ. So I think we'll kind of come around to this. And so I guess the remaining concerns, and again, I think other people teased at this. I think Linda mentioned some subgroup differences. I think disaggregations by both race and gender are going to matter. For example, we saw that the unemployment rate for black men actually rose this past month, even as the unemployment rates for other subgroup, race gender cuts were moving in the right direction. And so I think that monitoring process is going to be important, particularly because many of our families are just, they're not what I think the traditional snapshot of the family was. You have many men who are attached to families, even if they're not the custodial parent. And so having to monitor what's going on, right? Because that is going to affect the family unit with the dependent child in many instances. So, I guess I'll just close and say that as we monitor this, I think there is evidence that consumption is still down. That could kind of translate to a sustained downturn. And so I think that they were just watching for fluctuations in well-being that are also kind of tracking with the public health situation that's still evolving. So I'll stop there, and I really enjoyed all the presentations, and thanks to IRP.
Great. Thank you, Bradley, and thank you to both you and Pamela and to Zach and Linda for helping address this topic. We've had a number of questions come in, so I'm doing my best to try to group them. I wanted to pick up on one of Bradley's points there at the end. We're seeing some data on increased needs, and Pamela mentioned this at all, and we had several people wrote in questions concerning increased needs or needs that are still exceeding the amount of the benefit to date. One in particular, one point in particular was that although families are receiving maximum food stamp benefits, for those who have kids who are now eating all their meals at home and none of their meals at school, that may be a benefit. So Zach and Linda, if you could help understand kind of whether or how that would show up in your measurements and how you're thinking about that would be great. Linda, you seem to be muted still. There.
Oh, can you hear me?
Yes.
Okay. I think that's a really important point, and just in general about the hardships that we know that families are facing from various survey efforts. I think one reason, that's really the big reason that we want to move to looking at resources just over the second half of the year, because we think that's going to be a lot more telling, and I know Zach is doing the same thing as well. We are trying to capture the presence of the SNAP benefits in our modeling, but you can't pay the rent with SNAP benefits. So I think there's one issue is food insecurity. Another issue I think is trying to look more at cash versus food, and for instance at percent reductions in people's cash benefits. So trying to pick up that distinction between what kinds of help are people getting and what kinds of help are they not getting relative to the bills that they need to pay.
And I agree 100%. I'll just add on a little bit. I think what Bradley said before, there's so many data sources right now that are tracking income and hardship, and this is one of the reasons it's so important, as you noted, to try to triangulate these different sources and really understand what's going on. Maybe your earnings before were $50,000, your income is $50,000. Maybe today it's $30,000. In both cases, you're probably above the poverty line, depending on where you live. That doesn't mean you're not experiencing hardship or insecurity or severe income loss in this case. So poverty is one indicator. It's a useful indicator of what share of individuals are below the standard of that we deem to be the minimum amount necessary to live a decent life. But there's so many other important indicators to follow right now. Our team and Linda's team and others are trying to understand what is the mismatch between income, poverty, and hardship. And the only thing I'll say right now is that even in normal time, you see it's the case that most families experiencing food insecurity are actually above the poverty line. So it's important to keep that in mind, and there's much more work to do on this front.
Yeah, we actually had a comment come in from Kate, who works on the ground for an organization that works with food assistance. And she had an editorial comment which was, don't confuse being above the poverty line with being not poor. We had a couple of other questions about measurement. We had one request coming in from Renee Joy for Zach and your team, if you could do both the SPM and the OPM. And wondering about, you both Zach and Linda used kind of variations on the official poverty measurement. How should we be thinking about that in terms of forecasting benefit use, because so many programs actually go off of the OPM?
Right.
So.
That's a really great point. Another item on our to-do list is to look at information on changes in eligibility, which is something that we can get out of the microsimulation modeling, and those estimates will use the actual income definitions that are used by, for instance, the TANF program in each state, and the actual income definitions and limits used by the SNAP program. So I'm going to try to get that information out as soon as we can.
Okay.
Yeah.
We've also had a couple. Oh, sorry. Go on, Zach.
No, sorry. I think Linda answered it perfectly. So.
Got it. We've had a couple of questions about people left out of the CARES Act. And Zach, thank you for your group for kind of clearly noting that there are people left out. So we had questions about the steps being taken to benefit the financial well-being of folks left out. We also had a question that was from Manju. We had a question from Michelle about people who were working prior but are still not even under the aid to claim unemployment benefits. To give an example of a substitute teacher who apparently is having trouble claiming benefits. So really maybe for all presenters, because Pamela, I imagine this is a big issue that you're thinking about in Minnesota. What do we know about well-being of folks left out of these programs? What do we know about efforts to reach them and to get them some assistance during this pandemic?
So I'll just quickly add that we, as been said before, we know that the population we're talking about existed pre-COVID. So again, this public health emergency has not, again with the additional CARES Act funding, has helped but not really moved them out of poverty. We used to use the word self-sufficient when talking about our program, and let's move people to self-sufficiency. Well, closing off our program doesn't make you self-sufficient. It just makes you less poor. So I will just say that many of the initiatives that have taken place, we have waived some of, waived not a great word, but I'll use that now, waived some of the demographics we looked at and just cast a wide net in order to catch as many people as possible that may have been missed from the CARES Act and some of the more specific resources that have been made available.
Okay. We've had some questions also about the complexities of thinking about kind of people on the employed, not employed spectrum. Dylan from University of Chicago asked a question about people who have had hours reductions or earnings reductions but are still technically employed. How are they affecting the data, and how is their well-being affected? And then Michelle also asked a question about what's going to happen long-term for people who aren't going back to work.
Yeah, I can say from the perspective of our data, it's a really important question, and it is taken into account on our end. If an individual sees a reduction in hours or if hours worked on average are lower, the likelihood of poverty will be higher, of course, and we can see that in the monthly data that we're using from the census, and so that's part of the modeling as well. But it's an important point to make in general that, again, poverty is not confined to individuals or families experiencing joblessness. Again, Bradley mentioned earlier, low-wage jobs have not been great in this country for a long time. There's a lot of people who are in working poverty, and that continues to be a problem right now. So the second part of that question is clear that if the PUC benefits expire at the end of this month, that $600 per week unemployment bonus, a lot of these families experiencing joblessness now, their poverty rates will surely increase. It seems quite critical. I think all of us probably agree that that's extended in some form to make sure that the welfare state is still somewhat present for those individuals experiencing continued unemployment.
Okay, we're running up against the end of our time here. We had one more question sent in by Jenny, not me, different spelling. And she asked, is there a sense that politicians are reviewing research like this to base their decisions on? So I'd welcome your thoughts on that, but I also offer our panelists the opportunity to say, if politicians are reviewing research like this, what do you think are kind of the most important takeaways they should be thinking about right now? So one chance to give a final word before we close here.
Okay, that's a dangerous question to ask me about if politicians, but I will say that I think that we need to recognize that we need to look at the data and recognize that what we're doing pre-COVID, currently, and post-COVID is not enough. We identify that there's homelessness, we identify that there's poverty, but we don't do enough to raise the bar. So I would say that the most useful data I would tell a politician is, you have the data, now do something to move people genuinely out of poverty.
Bradley?
I would say that just a couple of quick takeaways. One, policy can help. What was done did help, so policy can make a difference. But that there are families who were not helped. So those who need to be thought about for the next piece of legislation.
I would just echo both Pamela and Linda and just say that, well, I do think that there are some politicians and political entities that are consulting with human services agencies who are looking at this on a daily basis, as well as the academic community. I've seen where there's been work out of the Joint Economic Committee where they've consulted with academics, for example. Now, obviously, the policy process gets messy, but I do think that some of those conversations are occurring, and hopefully having some traction.
Yeah, and I'll just make two small points on the policy side. I mean, first, again, it's really imperative that these PUC benefits are extended beyond the end of this month. And second, if we could go back to March 1st and wave the magic wand and import the Canadian welfare state, let alone, say, a European welfare state into the U.S., we wouldn't be in the situation that we're in now, at least not the same level of severity. So we have some large structural problems that Pamela noted have been going on long before the start of this crisis that really need to be addressed at some point. Immediate concern to extend those PUC benefits is going to be very important.
Right, kind of both short-term and longer-term ongoing issues here. So thank you all for your commentaries and your thoughtfulness here. Thanks particularly to Zach and Linda for their work in showing what policy is doing and isn't doing, and to Pamela and Bradley for helping us make sense of this, and for Dave at IRP for getting us all on the same screen at the same time. And thank you all for tuning in today and for sending questions. We didn't quite get to all of them, but we did get to a number. So I hope this webinar was helpful in giving you some sense of the known knowns and the known unknowns and the unknown unknowns, maybe even, of what's happening to economic well-being during this pandemic time.